Today we're going to be doing suctioning of a trach and cleaning the trach. And I'm going to start off with doing my general rules and safety practices. Then I'm going to do a respiratory assessment on my patient. I'm going to listen to lung sounds. I am going to watch the breathing pattern. I'm going to check for color. I'm going to check for capillary refill. Then I'm going to set my patient up. I am going to pre-oxygenate my patient. I'm going to turn my suction on, and I want to set the suction somewhere between 80 and 150 for an adult, and I would adjust if I had a pediatric patient. Then I'm going to check my suction and make sure it works, and it is working great. Then I'm going to cover my patient. I don't want any secretions to get on them. Okay, then I'm going to open my suction kit. Okay, I'm going to go ahead and open my normal saline. I'm going to leave it in the trash can. Okay, and then I'm going to put on one sterile glove. Okay, I'm going to reach in. I'm going to open my box. Then with my non-sterile hand, I'm going to add some solution. Okay, I'm going to move my catheter over. Now I'm going to put on my other sterile glove. Okay, now I want to remove my catheter. I'm going to connect it to the suction. And for this process, my right hand will be my non-sterile hand. So I'll hook that up. I'll make sure it's working by suctioning up some saline. Then I'm going to take the oxygen mask off. I'm going to insert my tube 4 to 5 inches. Then I'm going to pull it back out some, apply the suction with my thumb, and spin my catheter as I bring it back out. Then I'm going to suck up some normal saline. If I would need to suction again, I would re-oxygenate for 30 seconds in between each one, and I can do it up to 3 times. But I'm done for now, so I'm going to take my catheter. And since I'm going to go ahead and do a dressing change, I'm going to take the dirty dressing off now. And then I will take my catheter and the dirty dressing and fold it into my gloves and dispose of it in a biohazard bag. And I would clean up my mess from this and get ready for my trach cleaning. So I will do hand hygiene again. Okay, I'll do hand hygiene again. I will reassess my patient with another respiratory assessment. I'm going to listen to lung sounds again. I'm going to check for the breathing pattern. I'm going to check color and cap refill, and hopefully my patient will tell me that they feel better after being suctioned. So then I want to pre-oxygenate my patient. Since I've done an assessment, I will want to do hand hygiene again and I will put on a pair of clean gloves this time, and I will take the oxygen off. I will take out the old cannula, and then I will set up my sterile fields.
Why this place?
Okay, go right here and put my gloves on. Okay, now I will insert the clean cannula, and I will set up my supplies. So I will pour saline. I'll pour the saline in 2 of the containers. And I will pour the iodine in 1. Then I will take and dip my cotton swab in the iodine and clean, starting from the inside, 1 swipe, and I will throw that away. Then go out more, because I always want to start with the inside, throw that away. And then I will put that in some normal saline and rinse and throw that away. And then I will want to dab dry and throw that away. And I will want to insert my new sponge, trying to stay as sterile as possible. Okay. At this time, I don't no longer have to be sterile. The only thing I have left to do is to change the tie. I will insert this into my faceplate, and then I would, after I have this one in the holes, I would undo the old one and remove it. I would never want to leave the trach just sitting there, because if they cough, it will come out. And then I would remove my gloves, do hand hygiene, clean up my mess, and report and record.